Welcome everyone to the Ontario Caregiver Organization's webinar series. These webinars bring together caregivers and subject matter experts to explore topics of interest to caregivers. And we do this to support and engage chosen family, friends, neighbors, really anyone who's caring for someone else. My name is Katie Muirhead, and I'm going to be your moderator for today. We begin this gathering by acknowledging the Indigenous peoples of all the lands that we're on today. And while we meet on a virtual platform with people joining us from across the province, I'd like to take a moment to acknowledge the importance of the land we each call home. The land that I'm standing on is the traditional territory of the Haudenosaunee and Anishinaabe peoples, many of whom continue to live and work here today. This territory is covered by the Upper Canada Treaties and is within the land protected by the Dish with One Spoon Wampum Agreement. Today, this gathering place is home to many First Nations, Métis and Inuit peoples, and acknowledging this reminds us that our great standard of living is directly related to the resources and friendships of Indigenous peoples. As team members at OCO, we are learning about the lands from which we work and exploring how we can be meaningful allies and how we can support the recommendations from the Truth and Reconciliation Commission. We do this to reaffirm our commitment and responsibility in improving relationships between nations and to improving our understanding of local Indigenous peoples and their cultures. We invite you to take a moment to reflect on the land where you are. And if you're not familiar with that, we will be sharing an interactive map that tells you which traditional territory your city or town sits on. And you can find that at native-land.ca. Our webinar today is called Eating Disorder Quality Standards, Tools and Resources for Caregivers. Supporting a person with an eating disorder can be very stressful for family caregivers as they navigate the healthcare system to find effective treatment for their care recipient. This webinar provides caregivers with information, resources, and tools to help support them as they're supporting a person with an eating disorder to ensure they're receiving high quality care. Joining us today to speak to the quality standards is Sarah McTavish, who's the lead for clinical and quality standards with Ontario Health, and she supported the development of these standards. We're also joined by Maria Grandi and Wendy Presco, two caregivers who will share their experiences caring for a person with an eating disorder. Before we dive into those standards, I'd like to invite our caregivers to share a bit of their story with our audience. And we're going to start off with Wendy. So Wendy, if you'd like to join us and share a little bit more about your experience, that would be great.
Thank you so much for having me, and a huge big thank you to the OCO for including me in this very important topic. Good afternoon, everyone. This is my story and my experience with the unforgiving world of eating disorders. Eating disorders are not a choice, and eating disorders are deadly. I am dedicating this session to two families who lost their beloved daughters to their eating disorder on January the 16th and the 19th, 3 weeks ago. Jolene was 2 weeks away from turning 30, and Lindsay was 40. Both families founded the National Initiative for Eating Disorders through their struggles. 12 years ago, out of sheer desperation and frustration, I started NEED, which is the National Initiative for Eating Disorders, with my two co-founders, Lynn Koss and Patty Perry. For 10 years, we were an all-volunteer, not-for-profit, but now we are proudly a registered charity. We exist to give hope and support to individuals with an eating disorder and their caregivers. I am a caregiver to our daughter with an eating disorder, who at 38 still lives at home with my husband and I. When NEED launched on February the 22nd, 2012, I was on national TV for 30 seconds, reading our story, and my name and phone number was displayed along the bottom of the screen. Not even an hour later, the first call I got was from a family whose daughter had died by suicide exactly a year before because of her eating disorder. Since that date, my phone, emails, and text messages have not stopped, mainly from caregivers desperate for help. Our daughter has been fighting, challenging, and struggling with her eating disorder for well over 2 decades. She has missed out completely on all the teenage, adolescent, and young adult life experiences. In reality, there was very little help available for her then, and sadly, not much has changed. This fatal mental illness is totally misunderstood, underfunded, has minimum resources, and hardly covered in the education and training curricula for primary care professionals. As a caregiver, it is so hard to not only witness her physical decline, but her mental torture is agonizing for her and for us when she shares what goes on in her head like a spinning wheel. Her anxiety, franticness, and what she describes as her brain keeping her stuck and not letting her move forward has paralyzed her ability to progress and to have a life. She is so schedule focused that any time she feels she's running late, her panic, mood, and disposition flies off the deep end and all hell breaks loose. She gets totally tangled up with her own self-inflicted deadlines and times to get stuff done. Her quest for finding answers to her physical issues is unending. Aside from her family doctor, I have taken her to a dermatologist, gastroenterologist, allergist, and neurologist. She has a psychiatrist, endocrinologist, and is waiting to see a rheumatologist and internal medicine doctor. The wait times for these appointments is excruciating, and maddeningly, all these specialists operate in silos. So building a team of care for her has never been possible. When I think back to my daughter's early teenage years and taking her regularly to a pediatrician, I was included in her visits, could ask questions and be with her. When she moved from pediatric to adult healthcare, I would take her to appointments, but because of confidentiality or her choice, she would be seen by herself. On the odd occasion, she would share what went on and what was next. By her early 30s, she was too sick to think, talk, or remember any significant medical concerns. So she asked me to sit in on her appointments. She would ask my opinion or get me to answer for her. She had no voice, was so quiet, too weak, and needed me by her side as any conversation went totally over her head. Understanding this mental illness is so complicated and complex. Getting help is critical for caregivers to take care of themselves. This illness has no logic. Even to this very day, as much as we know, we don't know. There are many days we just look at each other and shake our heads. With any significant other individual in your life, being on the same page, on the same line, keeps you going. Search for your expert therapist or support group. A nurse psychotherapist with decades of eating disorder experience was an invaluable lifesaver to my husband and I. No caregiver or family should ever feel alone. Thank you.
Thanks, Wendy. Thank you for sharing that and sharing your personal experience and some of the challenges that you faced with the system. I hope that helps some of the folks in our audience today. I'd like to invite Maria now to turn on her camera and her audio and share a little bit more about your experience as a caregiver.
Thank you. Hi, everyone. I'm Maria Grandi, a retired physician and a mother of a 30-year-old woman with anorexia nervosa. When my daughter was 15 years old and in high school, I began to notice a number of changes in her. For example, she began wearing baggy clothes and was reluctant to eat. When I asked her about this, she basically told me I was overreacting. And she went from being very active and bubbling to becoming quite withdrawn. When I asked about her friends and how she was doing in school and about the gymnastics team, she replied to the effect that everyone was busy at school and she was told by her teammates that she was too muscular, which she didn't like. Actually, not that she was too muscular, just that she was muscular. She refused to attend any appointments with our GP. I began to panic inside. I was relieved when the school contacted us and encouraged us to seek help. We learned that her gymnastics coach had recently taken her aside and expressed concern about her weight loss. Now, she agreed to see the GP in order to obtain a referral to the McMaster Eating Disorders Program, which was exceptionally helpful. Their combined interventions gave us all hope that we could make it through this challenge. The homework assignments allowed for more productive discussions at home. And moving from family meetings initially, then to separate parent and youth support groups, gave us all new insights and helped us feel much less isolated. A big transition for us all was when Chloe chose to go to Queen's University in Kingston. I was petrified that she would relapse. Believing that her adjustment could be made easier by having people she knew around her, I was able to broker 2 interventions. First, we had some close friends in Kingston who agreed to invite her over for Sunday dinners. Secondly, when applying for residence placement, I did request special medical consideration for Chloe so that a good friend of hers was able to have an adjoining room to a shared washroom. In spite of these efforts, she had a relapse, and her heart rate fell to below 40 beats per minute, which prompted Student Health Services to make a referral to a cardiologist. I was fortunate to have been able to attend that appointment, since the cardiologist didn't seem to be familiar with the fatality rate of eating disorders. By my speaking up as her advocate, he came to admit that the mortality rate for this issue was extremely high. That statement thankfully resulted in her acceptance of individual therapy. Moving on to the pandemic lockdowns, Chloe was living alone and working full-time in Toronto. Since I was able to visit her frequently, I came to realize that she wasn't doing well. She avoided grocery shopping. There was never much food in her fridge, and she was rarely hungry when we went out to eat or I brought food. Thankfully, she did listen and hear my plea that she needed to find an experienced eating disorders therapist as soon as possible. Give me a moment. More recently, due to significant stressors in her personal and professional lives, she has been facing a major setback in her mental health. To her credit, she has reached out to emergency medical resources, her family and friends, for the support she needs. At this stage in my journey as a parent, I feel conflicted about being on the sidelines, watching her navigate this latest challenge. I'm slowly, very slowly, learning to be in the background, adapting my communication style and vocabulary, while continuing to be her cheerleader and her advocate. In closing, I would like to thank the Ontario Caregivers Organization for inviting me to share my story with you today.
Thank you, Maria. Thanks for sharing your story and providing a little bit of insight into some of the resources that you've tried. I'd like to express my gratitude and thanks to both of our caregiver guests today who shared very personal and emotional experiences to start off our session. By sharing this, we hope this helps all of you in our audience and those watching the recording feel less alone in your caregiving. If anyone on this webinar today is feeling that they'd like some additional support now or at any time while you're caregiving for a person with an eating disorder, we are going to share some information in the chat box for NEDIC, and it'll be included in our post-webinar email. NEDIC is the National Eating Disorder Information Center, and you can get connected to information and resources across Canada, including community groups, and they have a helpline that you can contact. That number is 866 NEDIC20. Wendy and Maria will be back later for our question and answer period. So if folks have any questions for them, please put those into the chat box and we will do our best to get to as many of those as we can with the time we have today. We are going to step away from the emotional side of caregiving now and jump into the practical side. Many caregivers look for answers and recommendations on supporting the people in their life. And so I'd like to invite Sarah to join us now to speak more to the quality standards developed by Ontario Health.
Thank you. And I'd like to echo Katie's sentiments and really thank Maria and Wendy for sharing their stories this afternoon with us. I am going to shift gears a little bit and speak to some of the work that we're doing at Ontario Health in eating disorders. And it's nice to be speaking to all of you today. Next slide, please. So just a little bit of background on what we know about the landscape of eating disorders in Ontario. So eating disorders are a severe illness with significant medical and psychiatric complications. And when left untreated, eating disorders can become chronic and really lead to short and sometimes long-term medical complications. We know that prior to the COVID-19 pandemic, roughly 4% of the population was affected by eating disorders in Ontario. But since the beginning of the pandemic in 2020, the healthcare system in Ontario has really seen unprecedented surges in the demand for eating disorders care. So we're going to take a little look at some of the data specific to Ontario. This slide shows us how eating disorders emergency department visits for peoples of all age groups. So the dotted line going down the middle, vertical line, indicates the beginning of the pandemic in March 2020. As you can see from the dark blue line at the top, there was a twofold increase in emergency department visits for people ages 10 to 17 with eating disorders. What's important to note about this is that many eating disorders visits are not captured as eating disorders if someone presents with something else, for example, fainting or a low heart rate. So unless there's already a diagnosis of eating disorders, they may not be captured in the data as such. So realistically, the rates only capture a proportion of the people that were being seen in emergency departments for eating disorders. Similarly, on this next slide, we see the rates of hospitalizations for eating disorders for young people, again, aged 10 to 17, which increased by about 50% from the beginning of the pandemic. You'll see on the line, the dotted line, to more recently. So quite severe mark with the beginning of the pandemic and use of hospital services. So in order to address some of this data that we're seeing in the increases in eating disorders demand, Ontario Health, as part of our pandemic recovery strategies specific to mental health and addictions, began to develop a quality standard specifically for the care of eating disorders. And I'm going to go into some of the details about that now. So for anyone who may not be familiar with quality standards of Ontario Health, I'll give you a little bit of background about what the quality standards are. So quality standards are a set of high impact statements that describe what high quality care looks like for a specific health condition or process where there may be a large variation across the province in what people receive for that care. So importantly, quality standards are grounded in the best available evidence. They aren't intended to be a minimum expectations for clinicians. Rather, they're outlining key opportunities for improvement in the healthcare system for conditions based on the data that we have, similar to what I just showed before in Ontario. The quality standards are really meant to set a standard for care, so that anyone receiving care, for example, in eating disorders, regardless of where they live or who is providing that care, receives a similar level of care. So clinicians and organizations across Ontario should read the quality standard to find out important ways that they can improve care for their patients and the way they offer to meet the standards. The scope of the quality standards includes children, young people, and adults with anorexia nervosa, bulimia nervosa, and binge eating disorders. And it applies to all care settings. It doesn't specifically address avoidant restrictive food intake disorder, often referred to as ARFID, or unspecified or specified eating disorders, but many of the statements in the quality standard would apply to those conditions as well. As part of our work to develop the quality standards over about a year's time, we work very closely with clinical experts and people with lived experience from across Ontario. So we wanted to share the list here. You'll see that Wendy was part of our committee, as well as Maria's daughter was there. So patients and caregivers play a very important role in the development of our quality standards. As I mentioned earlier, the quality standard really outlines key opportunities for improvement with the system. It's not comprehensive of care from A to Z of what someone would expect, but really those high impact parts that we need to focus on here in Ontario. And the committee helps us come up with these. So I'll just go over the 9 briefly to walk us through them a little bit. So number 1 is comprehensive assessment. And this really explains the importance of healthcare providers doing an in-depth assessment that looks at mental health, physical health, and any comorbidities such as substance use, so they can determine if the person has an eating disorder, how severe, and what the plan of care for them should be. Statement number 2 looks at level of care. So treatment for eating disorders can really range from self-directed interventions to much more intense, for example, live-in treatment or inpatient treatment. And it is important that people with an eating disorder receive the right level of care at the right time. Statement number 3 outlines the transitions from youth care to adult care services. So as we heard, for example, in Maria's case and in Wendy's stories, people often first develop their eating disorders at a younger age when they're teenagers. And this can lead to a big change in their care when they turn 18 or age out of that pediatric system. And this can sometimes result in big gaps and long waits in their care as they're waiting for the appropriate care in the adult system that often looks very different than the pediatric system. So this statement really explains how to ensure that that transition is as smooth as possible for the person and for their family. Statement number 4 addresses psychotherapy. So this explains what types of psychotherapy for eating disorders are most effective based on scientific evidence for young people and for adults. This is an area we know there's a lot of variation across the province in terms of what type of therapy is being offered. So we encourage you to take a look at the treatments that we know have the best efficacy and that might be most appropriate for the person you're caring for, depending on their age and on their circumstance. Number 5 looks at monitoring and medical stabilization. So it talks about the importance of people with an eating disorder receiving that ongoing monitoring and in some cases medical stabilization to prevent and address any serious complications from that eating disorder. This in some circumstances does mean hospitalization for a short period of time until the person is healthier. Statement number 6 addresses support for family and caregivers. Recognize, like with our lived experience stories just now, the real importance of support for family and caregivers of someone with an eating disorder. So we outline resources and education that can be helpful. Eating disorders are also very challenging for caregivers, as we've heard, and in your own experiences, I'm sure. Number 7 speaks to the physical, mental, and addictions comorbidities and how to address those. So it recognizes that people with eating disorders in some cases do have other conditions, for example, anxiety, post-traumatic stress disorder, sometimes substance use challenges. And often these challenges, they need to be treated at the same time as an eating disorder. So there needs to be a plan, a comprehensive plan that encourages treatment for those other conditions at the same time. It doesn't prevent the person from accessing eating disorders treatment. And statement number 8 really stresses the importance of healthcare providers treating people with dignity and respect. They should think about their own biases when treating people with an eating disorder and what they look like. There's so much about sort of stigmatization of people who might not fit the typical mold. So taking into consideration that eating disorders can present in anyone, regardless of age, race, social background, sexual orientation, gender identity, or body size. And lastly, wanted to address care for people who are not receiving active treatment. We often get questions about what does that mean? So in this case, this might be someone who's not receiving currently active treatment, but perhaps they're on a wait list for treatment. Maybe they've completed their treatment, but need some ongoing monitoring, or perhaps they've refused treatment. So regardless of the reason for why they're not currently in treatment, they should be offered monitoring that's suitable and follow up with their healthcare provider that meets their needs. So in a nutshell, that's what the quality standard covers, and we encourage you to look for yourself so that you can read the details and advocate for the person you're caring for. Now, I'm going to move closely to looking at our patient and caregiver guides. So the quality standard is just one piece of the documents that we develop. There's many other pieces that make up the quality standard. And so here we have our patient and caregivers guides for eating disorders. Typically, we just develop one, but due to the feedback that we receive from our panel, the patient version is quite different often from what the caregivers need. So we develop two guides. And I'd like to get into a little bit of what this includes. So the guide for caregivers is really a plain language summary of what's in the quality standard, what I just described. And it's designed to really empower the care partners so that they know what kind of care the care recipient should receive and what kind of support they should receive for themselves, so they can advocate better and effectively get the care they need for themselves and the care recipient. These guides also contain helpful resources for patients and care partners, including trusted websites where they can find information and support. So we're going to take a closer look inside. So this is just an example of if you were to look inside the caregiver guide, it summarizes the quality statements first. You'll find the explanation of what this means, for example, here in comprehensive assessment, what it means for the care partner and the clinician, that the clinician should ask things from the care recipient, depending on the circumstances, about their questions, thoughts, feelings, behaviors, and physical health. The clinicians will do this to find out whether the care recipient has an eating disorder and to make a plan for their care. Each of the 9 statements are included in the caregiver guide and are outlined in the same way. For a more in-depth look at the quality statements and the rationales and the definitions behind them, you would look more closely at the actual quality standard itself. Also in the caregiver guide and the patient guide as well, there's a section that suggests what you might want to share and discuss with your healthcare providers. So this is a list of key questions that you can consider asking the team, as well as important information that you may want to consider sharing with the healthcare team, again, to kind of elicit that best care possible. This list was developed with input from the Eating Disorders Expert Panel Group and people with lived experience as well on our panel. And finally, the black section contains a list of carefully selected resources from trusted websites that were identified by our panel. And here you'll find key resources, like we mentioned NEDIC before, I think it was put into the chat, the toll-free helpline. You'll find provider tools, a directory of community groups and other information and resources. You can also find the National Initiative for Eating Disorders Safely Crisis Readiness, and other essential information for caregivers in there. There are also 2 sites that offer free online training for families, parents, and caregivers, people with eating disorders, and we encourage you to take a closer look at this. I'm going to shift gears a little bit. These quality standards were published last year, and to kind of dive into the now what. So we have these resources available now, and to look a little bit more closely at what's happening at a system level as we begin to implement the recommendations in the quality standard. So the next step in this has been Ontario Health's work, really hasn't stopped with the development of the quality standards. In fact, there's the establishment of a Center of Excellence for Mental Health and Addictions, and eating disorders is a key priority there. So you'll see on this slide that the Mental Health and Addictions Center of Excellence, we often call it the COE, is really working to support a comprehensive and connected mental health and addiction system in Ontario. So it's really playing an oversight role of the delivery of care, like system management, supporting quality improvement, those dissemination efforts, and changing service expectations. So you'll see there that they have 4 key areas, and one of the 4 is on eating disorders. So this is a great step to including the quality standard, and many of their recommendations, as you'll see, are based entirely on the recommendations in the quality standard. Next slide, please. So this is a busy slide, but just to say briefly, the sort of 4 pillars of the Eating Disorders Provincial Program that's being developed is really to ensure that eating disorder services are standardized and evidence-based across Ontario for people of all ages. And the emphasis here is really on evidence-based services, such as those outlined in the quality standard. We want to ensure that families and caregivers and patients themselves are offered resources and structured support and education in the ways that meets their needs. And also that these services are offered regionally in a timely way for people so they can access close to home. And finally, to ensure that services people have access to professional development so that they can develop the competencies for things like comprehensive assessment and delivering those evidence-based treatments like psychotherapy. Next slide, please. So for now, the main focus is on outpatient care for the work of the Center of Excellence in Eating Disorders. So specifically people who received evidence-based psychotherapy in an outpatient setting, because we know this is trying to address things earlier on in the care trajectory, can often prevent people from their health from deteriorating and leading to more of that intensive treatment that can be needed. So working hard on standardizing that treatment and working on developing more evidence-based psychotherapies for people to receive in the community and close to home in an outpatient setting so that their lives are less disrupted. Before we go, I did want to just make sure that folks are able to access the quality standard online. There's that QR code there on the left, so you can use your camera phone and it goes to the link of that QR code. Or you can find the quality standards on our Health Quality Ontario's legacy website. Health Quality Ontario is now part of Ontario Health, which is developed. We now develop all the quality standards. So you'll see there under the drop-down menu, you click Evidence to Improve Care. And then you'll see the label of quality standards, the red arrow, and that will take you to the quality standards landing page. Next slide, please. And here, all our quality standards that we've developed and that are upcoming are listed alphabetically. So eating disorders is on page 2 there. And if you click on that, for example, eating disorders, here you'll see the quality standard there at the top, and then the patient guide and the caregiver guide, and further down are other resources for healthcare providers and system leaders for implementing the quality standard. There are some data tools and things like that for people working in the system. So that's how you access the resources that makes up the suite of the quality standard. And I just want to thank you again for joining us today. That was a high-level overview of the quality standards. But if you have any additional questions, please don't hesitate to contact us. Our email is there. And I'll pass it back to Katie for the question and answer period. Thank you.
Wow, thanks, Sarah. That was very helpful. We had lots of great comments in the chat box. So I'd like to invite all of our speakers back. We can go ahead and take those slides down. And so we can see everyone's faces. Fabulous. Thank you so much. This is our chance, folks. If there are questions, please put those into the chat box. We did get a few questions submitted in advance, so we're going to start off with those, and then we'll get to as many of those questions and comments that you all have in a moment. And I want to start kind of at the beginning. This is a question for, we'll get Maria to start and Wendy to follow up. And Sarah, if you have anything to add, you can go ahead. But I know we have a few caregivers joining us today that are newer to the caregiving experience, might be new to understanding eating disorders. I'm wondering if you can maybe point out some ways that you've identified if what an eating disorder is. And Maria, we'll start with you.
Well, that was a tricky question.
Yeah.
How do you identify an eating disorder in someone that you love is basically what I'm hearing, right? And putting aside that I have a professional background and I'm a parent, but some of the professional will creep in because it's inevitable. I think the really important thing truly is to know who your child is, to establish connections with them at an early stage, to know what their usual behaviors are, what their usual friendships are, how they usually do in school. And when your child starts to deviate from that, they start to change. Keep an eye on it. Trust your gut if you've been connected. And again, not everyone has that luxury sometimes of doing that. Life is hard for many, many people. So doing the best you can is really what I'm emphasizing. Doing the best you can. We're human. Pay attention, speak their language, educate yourself. I think those are the really important things from my perspective.
Thanks, Maria. Did you have anything you wanted to add, Wendy?
Well, yeah, coming from a non-medical background, I guess, Maria did touch on some very valid points. I think you do definitely begin to see a change in personality. I think isolation becomes pretty evident. There were some red flags that I did not know at the time, but I know them now. And I guess one of them, when our daughter started, she wanted to become a vegetarian. And not all vegetarians have eating disorders by any manner of means. But for her, it was a way for her to start restricting certain foods. And when she wanted to become a vegetarian, I was on board. It didn't bother me. You want to be a vegetarian, you can be a vegetarian. So I think looking back now, I can see things that were signals that I did not pick up when she was a little girl. And it's only through her having therapy that did we realize that she was actually very anxious from a very early age. And as a mom, a 5-year-old, like you wouldn't even think that a 5-year-old could be anxious, unless they're obviously showing visible, I don't know what kind of even signs. But it's only now, and talking to her over the years, that anxiety was definitely part of who she was. And the other red flags were just sort of wearing very baggy clothing. She didn't want anything touching her skin. My grocery list started to change. She started to scrutinize labels. All little things like that really at the time, I had no idea. It was like just really thinking hard as to what was changing and what was happening.
Sort of accumulation of things, identifiers that you see over time, and it's like a puzzle, right? You take all those pieces and put them together. Sarah, did you have anything else you wanted to add in terms of identification of an eating disorder?
I would just add that I think from our work on the assessment, the comprehensive assessment part of the quality standards, there are increasingly validated tools that clinicians will use when they're doing a formal assessment for eating disorders. So those do outline the things that Wendy and Maria spoke about. Those are becoming more and more comprehensive. While they're long assessments, I think they're very important, and they help people to identify signs of an eating disorder or disordered eating early on, if it's possible to get the person you're caring for assessed.
So those guides that you shared are going to be very handy for folks that might be new in this situation. Continuing on with those questions that were shared in advance, what are the causes of eating disorders? Do we know? Is there an answer to this? Is there an understanding of what causes this? And maybe Wendy, I'll start with you, and then we can go back in reverse circle.
So for our daughter, I mean, what she eventually told us and shared with us was that she felt, actually in high school, that she had no identity. Who am I? You know, thankfully, a million times over, there was never any kinds of abuse or trauma or anything relating to that whatsoever. But she was obviously predisposed as a little girl growing up, and words and things that were said to her that would normally sort of brush off a comment made by a family member or a cousin or a friend, that would normally sort of not dwell on any sort of other child who's not predisposed. Things with her started to accumulate. And when she felt worthless, she felt not understood. Who am I? I don't deserve this. Her self-esteem was below ground. So for her, that was sort of, I guess, the beginning of her, who am I? I'm not this, I'm not pretty, I'm not smart, I don't have this one's hair, and things like that sort of during conversations with her have certainly come up, you know, during our relationship.
Thanks, Wendy. Maria, what was your experience like with this? And did you have similar conversations and try to understand the cause?
Excuse me, I had to take a big swallow on that one. Just recently, through this type of forum, my daughter and I have participated last year in things where we're speaking as a duo to professionals about eating disorders. That's when she started actually opening up a bit more, and with ongoing therapy, she started opening up a bit more. So, and vice versa. So it was a two-way street, a sharing of information that it was really quite eye-opening to see, as Wendy suggested, how something as innocent as she was high-level gymnastics, for example, and you expect someone who's physically active to be muscular, to be toned. Yet that one statement basically just she wanted to lose the muscle, and it just like took a deep nosedive from that point. So can I say that I could have determined she was anxious? No, I don't think I could have. She seemed to hit all the right milestones, academically, socially, relationship-wise. I did have some inklings of possible other things, but you know, your kids are kids. You have to allow them to be themselves. You can't medicalize everything. So again, as a parent and as a physician, it was only later that when our communication improved, that I could say, well, you know, maybe that was part of it, and maybe this was part of it. But no, there is no, quote, cause for my daughter's eating disorder. There's a number of different underlying personality things, processing things. Again, we're all on a spectrum. Each and every one of us are on a spectrum of something. And it's knowing when it becomes unhealthy that really you need to intervene. Otherwise, I think diversity is part of civilization. Yeah.
Thank you. I think it's so important for folks to hear that, because I know so many caregivers who point to themselves to try to understand or figure out, is it something I did? You know, what is this one thing that's caused this really challenging situation. And got comments in the chat. Well said, Wendy and Marie. I think you put it so beautifully that it's a spectrum of things, and there is no one reason why this happens in your family and to the people that you love. I want to shift away from some of those shared questions into some of the questions and comments that came through the chat today around our quality standards. So there's lots of comments around the standards, and I know, Sarah, you had a whole diverse working group that contributed to these. And I'm going to sort of lump together two of the questions that have come in. One came in around how was this information shared? So you spoke to this sort of being launched about a year ago, and certainly this is one way that we're trying to get the word out about these standards and let folks know that it exists. And also sort of a piece that builds into that is if someone were to go to their family physician, you know, saying, this is a concern, or, you know, I've heard of these standards, are they going to go, oh yeah, I know about that, and here they are? Or is there something that caregivers should be armed with as they sort of embark on the medical side of this caregiving experience?
Thanks, Katie. I'll address the first part and then remind me if I'm missing anything, please. So in terms of disseminating and implementing the quality standard, we do a lot of conference presentations and webinars like this, you know, with the public, but also with healthcare providers to share the quality standards. We also have processes where during the drafting period, they're posted for public feedback. So there, through our communication channels at Ontario Health, that's also another way where folks can contribute, but also it spreads awareness about them. They'll see the sort of working draft and they'll be able to think about how they would implement them in their clinical practice. Now that Ontario Health is developed, we're a big organization now. Other parts of the organization that focus on primary care, for example, and regional care throughout the province, we work closely with them so that when, for example, primary care providers are doing their quality improvement plans and reporting plans for the year, that the quality standards are, as much as possible, embedded into their work that they're improving on. We have a lot of quality standards that range across topics. So not every healthcare team, for example, is going to have the same priorities or the same initiatives per year, but certainly also with the help of the Mental Health and Addiction Center of Excellence, that's really bolstering the knowledge and the awareness about eating disorders that I think really didn't, someone in the chat, I think, mentioned it, you know, it didn't have the visibility it did before compared to something like depression or anxiety, those other mental health conditions that typically we've heard more about, I think, in the media and in the public. So there is momentum there in Ontario Health as we continue to do this. It does take time, though. In terms of people's primary care providers and being kind of using the quality standards, I would say that really depends on them and the makeup of their clinic. We do have primary care providers that work very closely with us, those who have a lot of resources for quality improvement and have built the quality standard into their electronic medical records system. So almost like we call it a placemat, and it can be that physically or built into their computer system so that would have the statements there that they could reference if they had someone come into their practice that was concerned about an eating disorder. So that is a big piece of work that we continue to do after the quality standard is released, is that ongoing dissemination and implementation piece in the system. But I would encourage all care providers and patients, if they feel they're able to bring that information with them when they are seeking care, to advocate for themselves as much as they can.
Thanks, Sarah. I'm sure everyone on this call can appreciate some of the challenges in getting information out. And certainly once these standards and others like it are developed, that's not the end of your work. There's a lot more to go in making sure folks know about it. So everyone here can help spread the awareness as well as you go into your doctor's appointments and specialist appointments and saying, hey, have you heard of these quality standards? They're really great. And let's make sure everyone's on the same page. Another question from the chat around sibling support. And I don't know, Wendy or Maria, if there are other children in your families that were a part of this, but I'll open it up to our group here to provide a little bit of thoughts or comments around this. Certainly, there are other people in the family. There are the parents and the children and those that are experiencing an eating disorder. But what about those siblings? Are there any supports out there that you're all aware of, or that maybe others in your families accessed? And maybe Maria, I'll start with you, and then go to Wendy next.
Thank you for asking. Basically, when we started this whole journey 15 years ago, my younger daughter, 2 years younger than Chloe, she was included, but again, she was sort of like, it really didn't impact her truly. She had her own, she was in a different grade, different circle of friends. So I think she was kind of relieved because, again, as a younger person, she would have been 13, right? She'd just become a teenager, and all the changes that were going on in her, I think, sort of made it harder for her to really become part of it. And of course, as parents, we can't ignore our other child or other children, depending on how many you have. So I think it's up to the parent to try and gauge where the sibling is at. You don't want to overwhelm them, and you don't want to leave them out, and you want to recognize that they can be a help to their sibling. So not prejudicing your sibling, your offspring against their sibling, I think is really important, allowing them to develop a relationship. Now that Chloe and her sister are adults, i.e. living on their own, earning a living, their relationship has improved greatly because they can speak to each other on an emotive and a cognitive and intellectual level that they wasn't present before, not on Chloe's part or on her sister's part. So sometimes the patience that's involved is outstanding. It is challenging. And that's from someone who tends to go for things. So again, breathing is an important thing to just remember.
Thanks, Maria. Wendy, did you have anything you wanted to add around sibling support? Are you aware of things that are out there for those other folks in the family?
It was difficult. And I can honestly say that to this very day, it's difficult. When our daughter first got sick, my older daughter was not living at home. It was just my son, who's older than Amy, was at home, and he was very busy in his own career and getting his degrees and whatever. But I have to say that eating disorders can destroy relationships. That is the reality of an eating disorder. It becomes a parasite, in my mind, that can creep its way into everybody, from grandparents to siblings to nieces and nephews. We've got thankfully 4 wonderful grandchildren, and I actually worry more about them and what's going to happen to them in the future than what's going on right now. So for us, it has not been easy. There have been times when it's been extremely ugly, but we try our best. We just parents trying to bring up and love and give give 3 kids the most we possibly can. But it's not easy. It is not easy. I mean, my other kids feel our stress because we live with it 24/7. So it's difficult. I'm not going to, pull the wool over anybody's eyes. And as you said at the very beginning of this, the majority of the caregivers on this call have been dealing with this for more than 10 years. That is a long time. We've been at this for double that and more. So it's horrible.
It is.
It's endless and relentless.
Yeah. No, I think that's a really important, point to reiterate. I think those that have been doing this for 10 years or more understand that, but this is not a short-term illness that you're supporting. This is a lifelong challenge for so many people. And in terms of support, we had a couple questions around sibling support or parent groups out there. There's going to be a number of resources that will be shared, which will include, those community-based supports and resources, either virtually or in person. There's an organization for those on the call called Siblings Canada that's all about sibling to sibling support across a number of diagnoses and needs. And certainly here at the Ontario Caregiver Organization, we have a whole area of work focused on young caregivers, which aligns with those siblings as well. So for anyone 25 to 16, we have supports and resources for those youth as well that are available. So there are some resources out there, and all of you get that information as a wrap up to this call. And if you go onto those standard websites that were shared in the chat, you'll get some of that as well. Unfortunately, we are running very low on time. We've only got a couple more minutes left, and I see that there are other wonderful comments and questions in the chat. If there are any questions specifically to the standards, we will share a contact information so you can send that on to our colleagues at Ontario Health to ask and make some comments around that. And again, those resources are going to be shared out for you caregivers that are looking for support for yourselves or others in your lives that are caring for a person with an eating disorder. So I do want to just take a quick moment to thank all of you again for joining us today. Your personal stories, the quality standards, everything that was shared today, I think is so important and so helpful to everyone on the call and for those watching this recording. So I want to thank you all for sharing some time with us today and sharing your experience with us today.